Very good morning, good afternoon, good evening, everyone. So, we are discussing about another topic in pharmacology, that is your Hemantics and plasma volume expanders. So, what are Hemantics? Hemantics are your nutrients which are essential for the blood cell formations. So, it's the nutrients which are essential for blood cell formations. So these we call Hemantics. So what are the nutrients which is required for the formations of the blood cell? And formation of the blood cell, we call the process hematopoiesis, right? So hematopoiesis is the process by which your blood cells are formed. So the nutrients which are required for the formations of the blood cells, we called hemantics. So what nutrients are required? As I said, the nutrients which are required is your iron, right? Iron, vitamin B12, vitamin B12, right? And your folate. These are the major nutrients which are required for the blood cell formations, and these we called hemantics, right? Iron is important for the hemoglobin, right? So, iron is mainly absorbed in the intestines in the form of ferrous form, that is ferrous form we called Fe2 positive. So, it's absorbed from the intestines in the form of ferrous form, and heme contains this, iron in the ferrous form. So heme, Heme, heme contains the iron, and in which form? It contains the iron in ferrous form, right? But most of the inorganic iron is available in ferric form. Ferric form, that is your Fe3 positive, right? So again, I am repeating, what are hemantics? Hemantics are those agents which are required for the nutrients which are required for the formations of the blood cell formations. So what are these? These are the major nutrients which are required: iron, vitamin B12. Iron is the major components for the hemoglobin. Vitamin B12 is for your DNA, right? Then these iron, when we talk about iron, iron is, available in various form. So ferrous form of the iron is absorbed from the intestines, and this heme contains the iron in the ferrous form. But most of the inorganic iron is not available in the ferrous form. It's available in the ferric form. So what does it mean? It means that this must be reduced. So these ferric forms must be reduced to the ferrous form. Otherwise, it's not going to absorb. Ferric form is not going to absorb. So this ferric form of the iron from the inorganic, it should be converted, into ferrous form. And ferrous form, as I discussed, it's going to be absorbed easily. Fe2 positive, right? So, some substances like ascorbic acids, right? Your gastric acids, these HCl. So these acids will increase the absorptions of the iron, because these acids, ascorbic acids, hydrochloric acids, these convert these ferric form into the ferrous form. Whereas if substances like alkalis, phosphates, there is a drugs, antibiotics like tetracyclines, they decrease the absorptions of the irons. They does not allow to convert ferric into the ferrous. And as I said, ferrous form is going to be absorbed. So after absorptions, so iron can either be stored as ferritin, ferritin, So after absorptions, iron can either be stored as a ferritin or it is transported with transferrin. So it can be stored as a ferritin. After absorptions, it can be stored as a ferritin, right? Or it can be transported and transported with transferritin, transferrin, right? And transfer with the transferrin to be utilized for the formations of blood, to be utilized for the formation of blood. So that is we called Hemantics, right? So this is about, and you all knows if there is a iron deficiency, so it could result in anemia. So, so this is the ferrous sulfate. There are various preparations which are available in the market as a Hemantics. These your ferrous in the form of ferrous sulfates, but major adverse effects of oral iron can result in poor compliance, like it could result in gastrointestinal disorders, problems like epigastric pain, nausea, vomiting. Taste of iron is metallic taste, so it reduce the patient compliance. So, so these are the preparations which are available in the market as a Hemantics. And another one is plasma volume expanders. Few words about plasma volume expanders. Plasma volume expanders. I'm not going in detail, but few points about plasma volume expanders. So plasma volume expanders are, high molecular weight substances, high molecular weight substances, and it increases the osmotic pressures. And you want, because your blood pressure is down, so you want to maintain the blood volume. And examples is like Dextran, Albumin. And if you remember, these plasma volume expanders are useful in when there is a hypovolemic shock. Hypovolemic shock we have discussed in detail already. There is a loss of blood due to internal or external injury. So in that cases, you want to maintain, so blood pressures, you want to maintain blood volume. So how you are maintaining, you can give the plasma volume expanders. These are high molecular weight substances. These increase the osmotic pressures. Example of plasma volume expanders are Dextran, albumins, and useful in the hypovolemic shock. So this is all about Hemantics and plasma volume. Few words about Hemantics and plasma volume expanders. Thank you.